Respiratory examination done. Findings noted. Now, can you explain a serious diagnosis and get patient consent like a real doctor in English? Section 1. Roleplay.
Mr. Smith, thank you for your cooperation during the examination. I'd like to discuss my findings with you.
Is everything okay, doctor?
I'm concerned that your symptoms and examination findings may suggest a serious respiratory condition. At this stage, one possibility is a pulmonary embolism, which is a blood clot in the lungs.
That sounds serious. What does that mean?
It means that a blood clot may be blocking blood flow in your lungs, which can make it difficult for your body to get enough oxygen. This can be a life-threatening condition if not treated promptly.
What happens next?
We need to carry out some urgent tests to confirm the diagnosis. These may include a CT scan, blood tests, and monitoring your oxygen levels.
Will it hurt?
Most of these tests are not painful, but some may feel slightly uncomfortable. I will explain each step before we proceed. In the meantime, we may need to start treatment immediately, even before confirming the diagnosis. This usually involves blood-thinning medication to prevent the clot from getting bigger.
Are there any risks?
Yes, as with any treatment, there are potential risks and side effects. For example, blood thinners can increase the risk of bleeding. However, the benefits of treatment generally outweigh the risks in this situation. Before we proceed, I'd like to obtain your consent for the tests and treatment. Do you feel that you understand the situation?
Yes, I think so.
Do you have any questions or concerns?
No, I just want to get treated.
In that case, do I have your permission to proceed with the investigations and treatment?
Yes, you do.
Thank you. We'll take good care of you.
Section 2. Killer medical English phrases. Repeat and learn. These phrases are essential for breaking bad news, explaining risk, obtaining informed consent. I'd like to discuss my findings with you. I'm concerned that this may suggest we need to carry out urgent tests. This can be life-threatening if not treated promptly. We may need to start treatment immediately. The benefits outweigh the risks. I'd like to obtain your consent. Do you have any questions or concerns? Do I have your permission to proceed? Section 3. Practice. Exercise 1. MCQ. Medical English Collocations. Question 1. I'd like to discuss my A. Findings, B. Results, C. Informations, D. Datas. Quick, what do doctors actually say? Correct answer, A. Findings. Collocation, discuss my findings. Question 2. This may be serious. I'm A. Worried, B. Concerned, C. Afraid, D. Stressed. Think clinical, not emotional. Correct answer, B. Concerned. Collocation, I'm concerned that. Question 3. Some urgent tests must be A. Made out, B. Carried out, C. Done out, D. Taken out. Correct answer, B. Carry. Collocation, carry out tests. Question 4. If untreated, this condition can be life, A. Dangerous, B. Threatening, C. Risk, D. Critical. Correct answer, B. Threatening. Collocation, life-threatening condition. Question 5. Do you have any questions or A. Doubts, B. Problems, C. Concerns, D. Worries? Correct answer, C. Concerns. Collocation, questions or concerns. Question 6. There are potential risks and A. Effects, B. Problems, C. Side effects, D. Damages. Correct answer, C. Side effects. Collocation, risks and side effects. Question 7. The benefits. A. Overtake the risks, B. Outweigh the risks, C. Overload the risks. D. Overcome the risks. Choose carefully. Correct answer B. Outweigh. Collocation: benefits outweigh the risks. Question 8. I'd like to A. Take your consent. B. Give your consent. C. Obtain your consent. D. Receive your consent. Correct answer C. Obtain consent. Question 9. Do I have your A. Agreement to proceed. B. Permission to proceed. C. Acceptance to proceed. D. Approval to proceed. Final step: formal and precise. Correct answer B. Permission. Collocation: permission to proceed. Exercise 2. Comment practice. Write in the comments 1. Sentence explaining a serious condition to a patient. 2. 1 sentence explaining a risk of treatment. 3. 1 sentence asking for patient consent. And that's it. Respiratory consultation is now complete. History, examination, diagnosis, management, consent. Subscribe to Medical English Pro and take your clinical English to the next level.